Testing for malaria. Learning objective. By the end of this video, the participants will be able to 1. Prepare thin and thick smears using slides. 2. Diagnose malaria by using rapid diagnostic test kit and interpret the readings. Key messages. All fevers, particularly in malaria endemic areas, should be routinely tested for malaria. Malaria during pregnancy can lead to anemia and further complications to the mother and the baby. So early detection of malaria is important. The pregnant woman should be routinely tested for malaria at all antenatal visits in malaria endemic areas. Screen the woman for malaria every month, particularly in malaria endemic areas, by conducting the rapid diagnostic test even if she does not manifest any symptoms of malaria. If the result is positive, appropriate management should be initiated. Material for preparing thick and thin smear using slide. Clean slides. Cotton swab and spirit in a bottle. Lancet. Slide box. Lead pencil. Puncture-proof container. To prepare the blood smear, follow these steps. Select the second or third finger of the left hand. Clean with antiseptic or sterile wipes. Dispose of the cotton swab in the yellow bin. Allow to air dry. The site of the puncture is the side of the ball of the finger, not too close to the nail bed. Allow the blood to come up automatically. Do not squeeze the finger. Hold the slide by its edges. The size of the blood drop is controlled better if the finger touches the slides from below. Touch the drop of blood with a clean slide. 3 drops are collected for preparing the thick smear. Touch another new drop of blood with a clean slide for preparing the thin smear. Spread the drop of blood with the corner of another slide to make a circle or a square about 1 centimeter. Bring the edge of the slide carrying the second drop of blood to the surface of the first slide. Wait until the blood spreads along the whole edge. Holding it at an angle of about 45 degrees, push it forward with rapid but not too brisk a movement. Write with a pencil the slide number on the thin film. Wait until the thick film is dry. Wrap and send the slides to the laboratory for staining. The slide can then be examined under the microscope. Part 2. Malaria testing using rapid diagnostic test kit. Material. Monovalent and bivalent KRte test device for rapid diagnostic test. Reaction buffer or assay diluent. Accessories. Dropper, cotton swab and spirit in a bottle, lancet, puncture-proof container. Monovalent RDT kit can detect P. falciparum malaria. The steps for testing malaria using monovalent RDT kit are as follows. Store the kits at the recommended temperature. Check that the RDT kit is not damaged. Check the expiry date on the kit. Remove the RDT packaging and the dropper from the foil pouch and place it on a flat, dry surface. Label the RDT with patient's ID, date performed. Allow the reagents to attain room temperature if kept in cold chain. Select the finger for puncture. Clean with spirit swab and allow to air dry. Puncture the finger with a sterile lancet. Slowly add 1 drop of blood to the sample well and add 2 drops of the assay diluent. As the test begins to work, a purple color is seen moving across the result window in the center of the test device. Interpret test results at 5 to 20 minutes. Do not interpret after 20 minutes. Interpret the results correctly. Negative result. If only one line appears, the test is working and the patient is negative for malaria. Positive result. If 2 lines or bands appear within 15 to 20 minutes, the person is suffering from P. falciparum malaria. Invalid result. If no line appears within 15 to 20 minutes, discard the test and repeat the test. The steps for testing malaria using bivalent RDT kit are as follows. This test kit is preferred as it can diagnose both types of malaria, P. falciparum and P. vivax. Please check the instructions for the kit being used, whether it is monovalent or bivalent. Steps for testing malaria for bivalent kit are same as monovalent RDT kit. Result for bivalent RDT kit. Negative result. If only 1 line or band appears at C, control, the test is working and the patient is negative for malaria. If 2 lines or bands appear within 15 to 20 minutes at C, control, and T1, the person is suffering from P. falciparum malaria. If 2 lines or bands appear within 15 to 20 minutes at C, control, and T2, the person is suffering from P. vivax malaria. If 3 lines or bands appear within 15 to 20 minutes at C, control, T1, and T2, the person is suffering from both P. falciparum and P. vivax malaria. Invalid result. If no line appears within 15 to 20 minutes, discard the test and repeat the test. Key points. Malaria in pregnancy can lead to anemia and low birth weight baby. Detection of malaria by rapid diagnostic test kit and microscopy, followed by appropriate treatment, is important during pregnancy.